know so that we can be ready to go.
Is Kevin going to tune in?
He is. I just talked to him on the phone, so he should be here in just okay. We are on Zoom. We're live. So, Mike, I'll let you go ahead and just start us until Kevin comes on board.
Okay, give me 1 second. I just need to Okay, you ready?
I'm ready, and just because we're waiting for a few more to come on, if we could just hold on number 2 until more the new members are on.
Okay, sounds good. All right, well, I have to call to order the Wednesday, June 2nd, 2021 meeting of the City of Charleston Health and Wellness Advisory Committee. Thank all of you for taking time out of your busy schedules early in the morning to join us. And as we normally do, and as is probably good for all of our souls, we'll begin with a moment of silence, please. Thank you. We'll hold off for a minute, Paul, on agenda item number 2, which is introduction of the new advisory committee members. Next is approval of the minutes from May 5th, 2021. Hope you all have had a chance to look at them. Is there a motion to approve?
Move we approve.
Got a motion. Oh, the mayor. Motion is made the motion. Do we have?
Morning, everybody.
Morning, Mayor. Do we have a second?
I did.
All right, there's a second from Kimbo. Any additions, deletions? All in favor?
Aye.
All right. Opposed? The ayes have it. Paul, I'm going to move down to number 4. We'll wait till the introduction until Kevin gets on, if that's okay with you.
Okay, that's fine.
Okay, next is our fast track cities update. Dr. Richardson and Aaron O'Brien. I see Dr. Richardson here. I can't see everybody. So I'm going to turn it over to y'all, please.
Okay, Paul, it's telling me I can't share my screen while someone else is sharing.
Well, I'll get off.
Look at that. Paul is the master and wizard with all this. He get it for you.
I am not. So I actually sent the presentation to Paul in case I can't make it work. Let's see. All right, let me know if you can see it.
We can see it. It looks beautiful.
Okay. So Aaron O'Brien is actually on vacation this week, but he pulled the slides together and has done much of the work in getting our dashboard ready to go up for 2020. So I want to give a shout out to him, even though he's not here. Okay, hopefully that's on slide 2. So when we talk about fast track cities to ending the HIV epidemic, we are really concentrating on what we call 90-90-90 goals. And that begins, the first 90 is of those who are people living with HIV, how many have been diagnosed? How many people know that they are infected? So this first 3 bars look at 2018, 2019, and 2020 in that order. So the very first are how many people in Charleston, Berkeley, and Dorchester County. So the Charleston Metropolitan Service Area. How many people are estimated to be living with HIV? The next group are how many of those are diagnosed. The next group are how many are retained in care. And what that means is that they have seen a provider. And that for us involves having labs done in the past 13 months. The fourth group is those on antiretroviral therapy. So that's the therapy used to treat HIV. And the last is those who are virally suppressed, which basically means that their HIV is being managed such that they are not able to transmit the virus to others. So their viral load is undetectable for HIV. And basically what stands out here, the gray bar for retained in care is lower for 2020. And that's not totally unexpected. Many of us probably have not seen our providers during COVID. And even it is possible that those living with HIV saw a provider but did not get labs, because that would have sort of involved going into a lab as opposed to turning on your phone or computer to have that virtual visit. But nonetheless, that's something with HIV that we certainly hope improve this year. So this really goes to the percentages. So 90-90-90 means that we want each of these blocks to be at least at the 90 percentile mark. And again, these are the 3 90s that I just spoke about. And looking at these, comparing 2019 and 2020, again, what we see is those retained in care having decreased, the middle numbers having decreased for 2020 over 2019, but those that are virally suppressed having been increased. So that's certainly a welcome development, but really we understand it was lowest even in 2019 and continues to go lower in 2020. Those who are on antiretroviral therapy or seeing their provider is the area that we most need to address here in the Charleston area. This map looks at those who were not in care over, the last 13 months. So they've not gotten labs done. It's not exactly the same as not in care. They still may have seen a provider. But this is what DHEC uses as the metric for, because you need to continue to check the viral load to know that it continues to be undetectable. And so in Charleston County, DHEC estimates that we have 743 individuals living with HIV who have not seen a provider in the last 13 months. And that is one of the highest in the state. Only Richland County has a higher number than Charleston for this metric. So we're doing a couple of different things. As all of you may remember, 2 years ago in June, Mayor Tecklenburg signed the declaration through the Fast Track Cities initiative to make Charleston a fast track city to end the HIV epidemic. And these are some of the things that we are currently doing to improve outreach, to improve those 3 numbers, to get more people tested and therefore diagnosed, more people into care and continuing to see their provider, and then more on medication consistently that will suppress their viral load. So we do have a new website. I encourage you to check it out. It's called thefutureisyou.org. It's got wonderful visual images to help combat stigma, to encourage those who may be at risk, and really all to get tested for HIV if they've not done so recently, and then to engage in preventive services if they're negative, or connect to care, link to care if positive. So that's thefutureisyou.org, and has really all of the area providers and resources there in one place. We're also looking at implementing a peer community health worker program. So it will be comprised and led by people living with HIV, and would be coordinated through Trident United Way. And we are looking at applying for a grant through the Robert Wood Johnson Foundation to fund this. And should that not work out, we'll be looking for other funding sources. And then finally, as the mayor brought up, I think maybe it was 2 months ago now, or maybe more, the city receives HOPWA funding, and that stands for housing opportunities for people with AIDS. And so we are working with Miss Giona Johnson with the Charleston's Department of Housing and Community Development to incorporate language into contracts with developers. So developers getting funds to help to sort of build new housing in our area, and some of that housing be used for those living with HIV. And so we are working on including some language around prioritizing applicants who we would call fast track candidates for the Fast Track Cities Initiative, or returning to care candidates, that we would work with them to lower barriers to people living with HIV getting into this housing, and to allow agencies that work with the city on these sort of placing these HOCWA candidates to have some leeway in being able to have a sort of rent or transitional housing plan versus using the traditional vouchers, which can be in short supply, and not all of our service providers have those, to help to sort of use this as a carrot to encourage those who have fallen out of care to return to care. We also want to continue getting the message out about undetectable equals untransmittable. So that is sort of the message going back to that undetectable viral load, and the fact that if people living with HIV adhere to their medications and maintain viral suppression, they cannot transmit the virus to others. This is a powerful public health message for people living with HIV that encourages those living with HIV to engage with care and decreases stigma generally in the community. And we actually now have one of these sort of 3D sculptures here in the Low Country, this U equals U with the sort of flag imagery on it, that we would like to display around town with our various agencies and with the city of Charleston, to use it at events that we may be holding, as a message that we continue to emphasize with our community to move us forward towards ending the HIV epidemic. This is what our dashboard looks like. These are still the 2019 numbers. We're waiting on one additional number, which is those women living with HIV who are pregnant. What percentage of those were on antiretroviral therapy? That is our best preventive strategy to prevent what we call vertical transmission, or transmission of the HIV virus from mom to baby. So once DHEC helps us get that metric in place, we will upload the new numbers, and we hope to do that by National HIV Testing Day later this month. Finally, here's one more activity being done through the Fast Track Cities and SHAPE. We've had a Project Condom event, not last year with COVID, but in prior years. And this year we're doing a bit of a slightly different virtual option, which is called Masquerade, where teams of 5 participants, each including a youth, will design and create condom theme masks or other fashion accessories. And we'll provide various colored condoms for that. And I will send out the specific information on how each of you can join, either as a participant group or to join to support and see. The creativity is always really amazing on this front. So that's the end of the presentation. I'm happy to take any questions about our Fast Track Cities initiative, or any of the different sort of activities that I discussed.
Any questions for Dr. Richardson on this issue? Okay,
Dr. Richardson,
Yes.
you know, the number of folks that are out of care, you call it an estimate, but it's a pretty specific number, 743. Does that indicate y'all know who those 743 individuals are? And can we not do some kind of direct contact campaign to reach them?
Great question. So we do have 743 names on the list. And we have a data to care coordinator in the Low Country who is sort of interacts with that list on a daily basis. Now, you know, what we're not sure of is, are those 743 still, for instance, living in Charleston County? So we do try to sort of clean up the list by speaking to other states, trying to coordinate sort of, you know, if someone has moved or they have died or they might have gotten into care, but somehow we didn't get their lab, you know, those might be reasons that people would be on the list, and the list is updated quarterly. So we get a new map quarterly. So we are working on this list. There are some, as you can imagine, privacy issues. And so we do have some difficulty sort of looking at this list with our community partners to ensure that some of these folks may not be on their list, but it is a reportable, these labs are reportable to DHAC. So if someone is getting a CD4 count or a viral load done in the community, in this state, it should be reported to DHAC, and we should then be able to take that person off the list. And then our data care coordinator is trying to reconnect those who've fallen out of care. So she calls them and talks to them about, sort of goes through the, you know, the steps of re-engaging them with the care process and finding the best fit for them for a clinical provider. But as you can tell, that's a big number. We still have a long way to go.
Well, let me just suggest that anything we can do to assist, let us know. And I see this National Testing Day on June 27th, and I love your little U equals U equation. So if you want to plan something where we do like a little press event and have the display and announce June 27th when we get close to that date, we'd be happy to help arrange that.
Thank you. Yes, we would love to do that, and we will be in touch.
Great. Awesome. Thanks.
Thank you.
Anything else for Dr. Richardson as we move through the agenda? Hey, Paul, how about take down the screen share? I see that Councilmember Shealy has joined us. This seems like a good and appropriate time to introduce the new members of our committee. I'm sure the mayor will have a few words of advice, encouragement, and wisdom for them. So rudely and in a moment of complete unpreparedness, I do not have that list, Paul, of our new members, and I'm hoping that you do, so that we can introduce our new members. If not, we'll go around the screen and let them introduce themselves. And then I'm going to hand this meeting over to Councilmember Shealy.
Thank you, Councilman Seekings. Appreciate it. I apologize. I'm very sorry that I signed on a few minutes late, and I appreciate Councilman Seekings picking up and taking control and getting this meeting rolling, because we got a lot on the agenda, as you know. And but we are at an exciting time for our committee. We have some new members coming on. Many we say are new members, but have filled in and done such great work on here that they're really not new to our committee. But it is exciting. We have some top-notch people on our committee that are going to do some great things for us. So if you don't mind, what I will do is call on each of our new committee members. If you would just give us a little bit of information about yourself so we can kind of get to know you. So I'll start off with Quintinmpkins, please.
Good morning, Councilman Shealy, Mayor, Councilman Seekings. Thank you all for having us. Thank you for allowing me to join this distinguished group. My name is Quintinmpkins. I work for the Medical University of South Carolina. I've been here for about 5 years and done a lot of great work with Paul and some other initiatives and some other efforts with Councilman Seekings as well as the mayor. So I feel like I'm not a stranger to you all. But my traditional role at MUSC is government affairs. But over the past 5 years that I've been here, my background is in public health. So I've done a lot of work with outreach and within the community. And over this past year, I've been leading up a lot of the COVID testing and vaccination efforts for MUSC throughout the state. So again, thank you for having me and allowing me to be a part of this group, and look forward to working alongside with you all a little closer.
All right, thank you very much. And Meredith Palinski is certainly not a stranger to our group, but officially we welcome him as a new member. So Meredith, tell us a little bit about yourself.
Hey, thank you. I'm actually a Charleston native, born at Roper Hospital. Did go to Wando, so don't hold that against me. And through the ranks of MUSC and Citadel and and whatnot, I do work here at Roper St. Francis Hospital. I work in the pain management department, run that and neurodiagnostics within the hospital. And I've already been like Kevin said, here in this committee for a couple of years now, through Mark. And it's been a real eye opener. I love seeing the city at work and seeing what we can do for the city of Charleston. It's home, obviously, and it's just been a great eye opener and an awesome spectacle just to watch and be a part of. And everybody's just been amazingly helpful. I've been on committee with Katie and Joey is amazing. I'm also doing some stuff with behavioral medicine with the United Way, and so other committees have spawned off, and it's been a real pleasure. And I'm just whatever I can do to help personally and through Roper St. Francis, I'm here for.
Thank you very much. We appreciate the work you've done, and we look forward to what you're going to do for us. And we really appreciate your time. Aretha Jones Powers is representing Fetter Healthcare. Aretha, see her name on the screen, but I don't see her face. All right, maybe we'll come back. And no stranger, obviously, to our group is Dr. Katie Richardson with South Carolina DHEC Low Country Region. So, Dr. Richardson.
Thank you all. So I have had the pleasure of being on this committee for my boss, Taylor Lee, our health director, for some time. And he has graciously allowed me to now become the official member. So I'm the medical director for the Low Country region of DHEC. That means I'm the physician for 11 counties in sort of the bottom quarter of the state. And I'm a family physician by training, worked at community health centers and some free medical clinics in the Charleston area prior to joining DHEC now 6 years ago. I love working with this group and I look forward to continuing it. Thanks.
All right. Thank you, Dr. Richardson. Appreciate all that you do. And Kimbo Yee represents the Citadel.
Everyone, thanks for having me. So I'm in my third year as a professor in the Department of Health and Human Performance at the Citadel, specifically within our exercise science program. And I was actually connected to this committee through a previous committee member, Dr. Dan Bornstein, who has since moved on to other professional endeavors, but him and I shared a lot of scholarship interest and public health, physical activity, physical fitness, and obesity. So, he nominated me to join this committee, said it was a great group of folks to work with, and absolutely look to working with you all to help everyone accomplish their goals here.
Thank you. Excited to have you. Thank you so much. Dr. Annie Andrews, no stranger to us either, but Dr. Andrews.
Sure, yes, thank you. So I'm Dr. Annie Andrews. I am a pediatrician. I take care of children at MUSC Children's Hospital, where I'm an associate professor of pediatrics. I'm also the director of advocacy for our Department of Pediatrics, and I'm here officially representing the Charleston County Medical Society. And in that group, I'm really active on the school health committee. And as you all probably are already aware, my personal and professional focus right now is on gun violence prevention. So I like to bring that lens to this group as well. So thank you.
Thank you. We appreciate all that you do for us and all the time that you commit to this committee. Maggie Dangerfield represents Charleston County School District. And I see Maggie's name on there, but I don't see her face. So Maggie, are you there?
Yes, sir. Hey, Councilman, I apologize. I'm at home with some sick children this morning, but I am excited to be serving another term with everyone. I'm the Director of Strategic Engagement for the school district. I work in our Division of Strategy and Communications, and within my role, engage with all of our community partners, municipal partners, internal and external stakeholders, working along recently with our nursing services department to support all of our vaccination and COVID mitigation efforts. And in previous to my current position, I spent almost 5 years doing sustainability and aspects of wellness with the district. So really excited just to continue working with everyone and connecting CCSD and plugging in where we can to support community health.
All right. Well, thank you, Maggie. And I just want to say thank you. I was reappointed, and Councilman Seekings was also reappointed by City Council this last week. And, I appreciate being on here. I serve District 2, which is kind of the western part of West Ashley, down Glen McConnell near West Ashley High School. But obviously, I represent everyone in the city of Charleston and have everybody's concerns at mind as I serve on City Council. And I don't know if Councilman Seekings wants to say something. You're welcome to.
Just very briefly, thank you, council member and members of the committee. This is one of the things that I look forward to every other week or every month as part of the role that I serve as City Council. It's been a really amazing committee. I've served on it since the beginning. I want to thank the mayor for reappointing me and council member Shealy. I think we've actually done some really great work on this committee. I can tell you, we do a lot of this. And the things that come through here and make it up through into city council chambers get close attention. And I really want to thank those of you who have continued to serve and those of you here in advance for spending an hour about every month with us, because it really makes a huge difference. So thank you in advance. And I am going to rudely have to cut out because we've got a lot going on in the city. And so, Mayor, I'm going to go talk about the 3x3 study for a little bit. So thank you all very much. And Kevin, thanks for taking over this morning.
Thank you, Mike. All right, very good. And as I said, I came on late. I apologize. Did we approve the minutes from May 5th?
We did.
Okay, very good. Thank you very much. And yes.
Nick Osborne.
Okay. All right. So let's introduce Nick Osborne. Nick, I am so very sorry. I did miss you. If you would tell us a little bit about yourself.
Yeah, no, thank you very much indeed. And just to say what a pleasure it is to be part of this group. I am new to the Charleston area. I have been in the Charleston area now for 4 months now in my position as the president and CEO of the Low Country Food Bank. I'm sure many of you know, but Low Country Food Bank, and we serve the 10 coastal communities in terms of addressing issues of food insecurity and hunger. And as part of that work, is very much around looking at the intersection between food and other issues related to health and wellness as well. So it's how does the intersection between food insecurity, the health, well-being, education, and other forms of people's livelihoods. So really excited to be part of this group. And I come to Charleston having worked in the food insecurity sector for 30 years of my career from an international development perspective. So really interested in bringing my international development experience in food insecurity and applying it to contexts here in South Carolina. So great to be with such a wonderful group and really looking forward to engaging and joining in whatever way possible I personally can, but also from here at the Low Country Food Bank as well.
Thank you, Nick. We appreciate it. Thank you very much. And thank you to all of you that give so much time. I know that this group, your time is extremely valuable, and but the value that you bring to the city of Charleston and really the Tri-County area is incredible for us to have this. We're very, very fortunate as a city to have this level of expertise and your willingness to give your time so that we can be a healthier city and area. So just want to say thank you again to everyone who commits all their time.
Mr. Chairman, can I add my thanks and
yes, sir, Mr. Mayor.
Brief comment, and then if I know this may carry on a while, but I thought maybe you'd continue around the table here and just have the members who are returning just briefly introduce themselves so that the new members know everybody else. But I just want to make the comment that just on a personal basis, we talk a lot about quality of life. And there's nothing more that impacts our personal quality of life than our health and our wellness, right? So if you just extend that concept to our whole community, I believe it applies. I mean, nothing impacts the quality of life of Charleston more than the health and wellness of our citizens. And so I must comment on the agenda for today, how happy I am. I know Dr. Richardson will agree. We're not talking about COVID today. We're back to the business of so many things that we had started work on, like our inequity issues with health. If you look at the map of life expectancy in our region, the Fast Track Cities initiative, the Heat Watch program that we've got going this summer. So this is very exciting. Good work, great work. I just want to thank in advance for another year for everyone's efforts and the incredible goal of improving health and wellness in our city.
Thank you, Mr. Mayor. I appreciate that. Paul?
Kevin, I really wanted to introduce, there's 3 other individuals that are on that are not members, but they are community partners that we treat as members on this group. And that is Joey Current from Trident United Way. He can say a few things in a minute. Kim Butler Willis, Kim is on our Special Commission on Equity, Inclusion, and Racial Conciliation, heading the subcommittee on health disparities and environmental justice, and she's the community health director for Roper St. Francis Hospital. So we got a wonderful person there to join us. And then finally, Holly Cutt with the CCSD oversees their health and wellness programs, especially the scorecard program that looks at wellness in the schools. And she's also in here as, we've got our members, but we've got these community support people that really make a big difference for us. And I just really want to say thank you for them joining us as well, too.
Yeah, thank you very much. Joey, do you want to say anything? You're certainly welcome.
Oh, just thank you so much for having me here. Yep, Trident United Way. We work closely with our partner hospitals, Roper and MUSC, to put out a regional health improvement plan that includes the city of Charleston. And I'm very excited to get to help out on the task force that's looking at life expectancy, health disparities, and we've got some great work ahead of us.
Thank you, Joey. Appreciate all that you do. Kim, would you like to have a few words?
Just one good morning, friends, because most of the people on this call, I get the opportunity to work with monthly. So it's great to be a part of just another group where we can do some good stuff.
All right. Very good. Thank you, Kim. We appreciate it. Is Holly on? I don't see Holly on my screen.
I'm
there
here.
you are. Okay. I'm sorry.
Yeah, thank you. I'm so happy to be a part of this group. Right. So I'm the contact for the district for our school wellness programs in all 86 schools. And I also serve with the Charleston County Medical Society school wellness group. And then I also serve on the ACT Force, the drug prevention with Judge Hendricks and that education committee. In addition to my real role, which is instructional specialist for all of our health and PE teachers, and helping them with instruction and helping them implement everything that from the community and make sure that all of our students are being served the correct way with our curriculum. But happy to be here and thank you.
Yeah, thank you, Holly. We appreciate it. Lisa Burbage, I'll call on some of our remaining members who are not just coming on, some of our continuing members. So Lisa.
Hi, everyone. My name is Lisa Burbage. I'm the owner and CEO of Wellness 5. And what we do is corporate wellness. We work in the with companies trying to improve the eating and improve the nutrition and the moving more of their employees. And also I do some work for the CDC through another prevention program focused on preventing type 2 diabetes. So those are my focus areas.
All right.
Thank you for letting me be a part.
No, we appreciate what you do. Thank you so much. And Susan Johnson.
Hi, I'm Susan Johnson. I'm the Health Promotion Director at MUSC, and I serve as an appointed member. I believe I represent the built environment active living component, and I just really love all the collaboration. And as Mike said before he had to jump off, I think this is one of the committees, and I'm on many, that we actually get a lot done. And it's really an honor to be a part of this group. I'm also currently chairing our Health and All Policies subcommittee, and I'll be doing a little short report out on that before we check out today.
All right, thank you very much. I see our our mental health expert, Jennifer Roberts on. Jennifer.
Hey, good morning, everyone. I'm the executive director of the Charleston Dorchester Mental Health Center. So we're one of the 16 mental health centers in the state, or state agency. We serve children and adults and babies in all ages. And I've been a member, I think maybe 5 years, and I ditto to what everyone else has said. This is it is a great group. We all learn a lot from each other, and I'm really happy to be part of the group. So thank you. Good morning.
Yeah, good morning. Thank you for all that you do. And I see our neighborhood advocate, Miss Carolyn Murray on. Carolyn? Carolyn, you're on mute.
You would think I know how to use a microphone by now. But, good morning, friends. It's good to see all of you, and certainly happy to be a part of this committee, echoing what a lot of you have already said, that we work with various organizations and agencies, and this is one certainly that brings it all together, taking care of our families and our friends. And I've worked as a journalist for more than 30 years, and certainly the most important part of any work that I do, it's taking care of myself, taking care of my family, taking care of people in our community. And I'm happy to be a part of an organization, a committee that's taking care of people. So thank you so much for all the great information I'm able to take back to my colleagues in the newsroom every single time. So I appreciate you delivering such good information, and please always say yes when a reporter asks you for information and to get a story on air. We appreciate it. Thank you.
All right. Thank you, Carolyn. We appreciate all the good work you do and spreading the good news for us. Thank you so much. Let's see, Reverend Dr. Crystal Sears, our faith-based community representative. Are you on there?
Hello. I am actually driving to church, so please forgive me. I don't want to look down and press any more buttons. I'm just so honored to serve. I'm thankful and grateful for this committee. I am the pastor of Greater St. Luke AME Church, 78 Gordon Street, downtown Charleston. And I love serving there, and I also love serving on this committee. As I've served, I've been able to disseminate information, vital information from this committee, and spread it through, colleagues, friends, and the religious sector and community. And I'm looking forward to being more active side by side with you all going forward.
All right, thank you very much. Is Amy Seago on?
Yeah.
I don't think she is. Okay. Did I miss anybody? I think I've got everybody this time. So.
Laurie Yarborough.
Oh, Laurie. Yes, Laurie. Sorry about that.
Oh, that's okay. I'm the beneficiary of all these good folks and all this good work. It's really amazing in the 20-something years that I've worked with Paul and worked at the city, how Parks and Recreation has taken into some new things. And I believe it's because of the work of this group. I mean, during COVID, just really the connections to our community through our community centers and getting folks to testing sites and to vaccination sites and to get signed up and get information out, mental health, all of those things that you guys have brought to the table and connected us with. I'm very grateful and appreciative that Parks and Recreation gets to be a part of that. So thank you. Thank you, Laurie. We appreciate all that you do. Thank you so much. Okay, so I do want to say thank you again, the city of Charleston. We are extremely fortunate to have the people that we have on this committee, and just want to thank you again. I know your time is very valuable. You do great work in our community, and we thank you for what you do for the city of Charleston and our area. So I think the minutes have already been approved. Paul, are we at number 5 or number 4?
Number 5.
Number 5. Okay. All right. So we'll get a report on health disparities and environmental justice subcommittee, special commission on equity, inclusion, and racial conciliation update. We'll call on Kimberly Butler Willis.
Thank you again. So good morning, friends. Just to give you an update on the special commission. So we finally have a draft document that has been submitted for review. And now we're just going through that iterative process of reviews and approvals before we can actually move those recommendations down to the public. So right now it's under review by the commission. After the commission, it will be sent over to City Council for their review. And along with that review, we've also asked that the county council go through special D&I training. And so they'll do that simultaneously. And as those recommendations are approved, they'll move down to the special committees that will put some legs on those recommendations. And it also has been suggested that those leaders go through the same D&I training. So I suspect, just knowing administrative processes, that this will take many weeks and some months, but as we have more information available, I'll be sure to share it with this committee and with the general public. So please feel free to shoot me an email if you have any questions or concerns about the specifics of that report. But there are about 7 subcommittees, and last month I reviewed exactly what was included in that health disparities and environmental justice suggestion box. So please let me know if you have any questions, but that's the update that we have right now.
Any questions?
Any questions?
Okay.
All right.
Well, thank you very much. Oh, Carolyn, sorry.
Hey, Dr. Willis, thank you so much for your great information. And we fortunately were able to speak with you, I think, last month after our last meeting and get some more information about disparities in our community. I wanted to find out more about that training you were describing for a county council member. Can you tell us more about
City council?
For city council, pardon me, for
Right,
city council.
Yeah.
Yeah, and so what we're thinking is that City Council, a lot of what we do in diversity and inclusion work could be very subjective. And the beauty about the work is that it's really contingent on conversation, communication, transparency, and even review of those objective facts. And so we'll have a consultant come in to do that D&I training with the City Council, just to make sure that they have a firm understanding and grounding on some of the inequitable are the access points that we will discuss through those recommendations, so that they feel up to breast on what exactly they're reviewing. So right now, we don't have any firm details on who that consultant will be or what the lessons will entail, but I do know that they will be comprehensive and there will be an attempt to touch on all the subject matters presented in that document.
All right, thank you again. Any other questions? Well, thank you again for that information. We appreciate it. And we are going to move on to Health and All Policies Task Group update. So I'm going to call on Susan Johnson.
All right. So our group, after our last meeting, Paul and Joey and I had the opportunity to meet with our new city planner, Robert Summerfield, and we had a great conversation with him. We are really excited. He seems to really have a passion for quality of life and, have all the things that we've been talking about around the built environment, transportation, access, parks. So I think he's going to be a great advocate for us. Other than the introductions and just kind of understanding his philosophy and what he brings to the position, we also kind of shared with him our goals for our Health and All Policies group. And, in particular, that when we had gone to City Council, our first step in Health and All Policies was to work with the planning office on integrating health into the comprehensive plan. So I believe I think Joey provided a kind of an overview of the community input at our last meeting. And so as a follow-up to that, we asked Robert some questions about, kind of what is the process, next steps, how can we provide input? And right now, and I checked with Councilman Seekings before our meeting, he has not, and Councilman Shealy or Mayor, you can confirm this as well, that y'all have not received the draft. And what has been available is not complete, but it does give us information on the community feedback and some of the priority areas. And so on our conversation with Robert, he asked us to start sending him, either some language or some specific areas that we would want to see in that plan. I have sent him some information on the extreme heat that hopefully will be added. And I know that Joey had some specific language that could be added, but it's really hard for us without having that draft to be able to provide some specific recommendations. So Councilman Seekings has said that he would continue to communicate with our group, and as soon as that draft comes across his desk, that he would let us know. And then, as I understand it, the draft needs to go to City Council, and I think the goal was sometime in mid-July. Councilman Shealy or Mayor, do you have any updates on that?
I think we get the draft on our next meeting on June 15th.
Okay. All right.
Yeah.
Great.
Yeah.
So that'll be an opportunity. We'll continue to work as a group to, even without having access to the full draft, kind of knowing the buckets, that we can put some ideas on paper and get that to that group. Yeah. But I think once the draft has been presented, then we'll have the opportunity to give some more specific feedback.
We'll have it soon, and rest assured you'll have it.
Fantastic.
Yeah.
Susan, while you're right there, Katie, I just was curious if Katie could maybe just give us an update at the same time on their data work they've been working on life expectancy.
Yeah, so I think there was a final map that I shared with Paul, and he shared out with this group, sort of trying to get even more granular in the city of Charleston for the differences in life expectancy. And then our population data group in Columbia also pulled some of the sort of social determinants of health data disparities within the city, and that was shared with the sort of health and all policies group. Is that what you're talking about, Paul?
Yeah, I just sent that out to everybody as well, so you can look at it later. But I just want to let them know that y'all are working. I know we were going to try to see whether we could come back in the next couple of months with some recommendations, and I just want to let them know what y'all were doing.
Yeah, the last part is that we are working on a data agreement with Vital Statistics so that we can develop our own. The life expectancy disparity data came from the Robert Wood Johnson Foundation, but we don't have assurances that it will continue on a regular basis going forward. So DHEC is working on a mechanism for us to continue to be able to produce that data so that we'll be able to use it to evaluate our efforts on reducing these disparities going forward.
Thank you. Sorry, Susan.
Mayor Tecklenburg?
If I could add a little update, when you look at those maps of the disparities in life expectancies, it's not just the city of Charleston. The kind of lowest expectancy, worst areas, if you will, are the northern part of the peninsula of Charleston, but the southern part of the peninsula of North Charleston. And some of that area includes unincorporated areas of Charleston County. So I met last week with County Chairperson Teddy Pryor, who also worked for the city of North Charleston, and I've shared this information so that as we move forward with some specifics about how to address those areas, particularly those that are in the 60s there, that we include the city of North Charleston and Charleston County, along with all of you here, that this become a real focused community-wide effort.
Okay. Well, thank you. Any questions for Susan? Okay, well, thank you for that report. Well, we're going to call on you again for the CDC grant opportunity, if you will, please.
Yeah, so this actually, we want to thank Dr. Richardson for bringing this to our attention. And I think our team, the Health and All Policies Task Force, saw a huge opportunity to move our work forward. And so we've kind of shifted our focus specifically because of the short turnaround on this opportunity. But we engaged with the city grant writer, and I don't know if she's already left for maternity leave, but we were able to actually pull a meeting together with her on May 17th to review the RFP, and all agreed to move forward with it. Paul then presented this to the mayor and got his blessing for us to move forward with it as well. So real high level, it is basically a planning grant. The max is $125,000. No matching required. They will award 20 of these. It's a CDC grant. 20 cities or tribes, municipalities will receive this funding. The grant, our proposal is due on July 6th. So as you can see, we have a really quick turnaround, but several of us got on the information webinar, and fortunately it's not a huge proposal in terms of the requirements. The narrative is about 6 pages, and we already feel like we have a lot of folks in place that can help pull this off. And in particular, we want to thank Joey and his colleague Renee, who have offered to kind of take the lead since Sarah is out on maternity leave. We actually have another meeting this afternoon. And then I believe we do need to run this through City Council on June 15th. So I just want to make sure, Councilman Shealy, that we have that on the agenda. But again, as I said, it's a planning grant, and the outcomes would be to develop an implementation ready social determinants of health accelerator plan. So we will, and in addition to that, convene and coordinate a leadership team with multi-sector partnerships. And so this is just, again, is so in line with what we're doing right now. We can select 2 areas to focus on, and the grant priority areas include the built environment, community clinical linkages, food and nutrition security, social connectedness, and tobacco-free policy. And what they really want us to do is access data within the past 5 years, which we have already started to gather. Katie's been sending us a lot of new data through DHEC. Kim has been connecting us with some data, and then we have the community needs assessment. So we really feel like we're well positioned, and we're going to do everything that we can to put the best effort towards this proposal and hopefully win it for the city. And we also believe if we're awarded, it starts September 30th and it's a 12-month grant, that it will really position us for follow-on funding for the implementation of the plan. So we'll be certainly looking for those opportunities if we're awarded.
All right, thank you. Mr. Mayor, any issues with getting that on Ways and Means and City Council? Everything's good there? Okay, great.
I will add, Susan, that Charter United Way, since our grant writer has gone out on maternity leave, that Charter United Way has agreed to help us write the grant using the information that Kimberly and then we've all been writing grants for Tri-County. So we've got a lot of good resources sitting there to help us do it. It's a small one. It's about 6 pages total. So we should be able to pull this off on a timely basis. But thank you for everybody. And we'll be looking at our community partners, make sure we bring them to the table in the discussions of what this actually would look like. So.
All right, very good. Any other questions on the grant, on the CDC grant? Okay, we're going to move on to our heat watch update. So I'm going to call on Susan again for that.
I'll try and make this short and sweet. Can y'all see my screen?
Yes.
All right, great. So I know I've reported on this previously, but we continue to work towards the Kappa heat watch. We actually do have 2 research programs going on simultaneously. The first one, this CISA heat research, is using wet globe temperature measurements. And we'll be doing that this summer with two study groups. One are grounds folks from MUSC, and then the Citadel folks. So that will be happening. But the one that I really want to focus on is the Heat Watch research, which is the project that we applied in January and were accepted. So we're joining 11 other states and multiple communities. The closest to us is Raleigh-Durham, but we've been on many calls with NOAA, kind of ramping up for this. It's really exciting. We've also been working with our local meteorologists and NOAA folks to identify when is the best time to do this. We get 1 day to try and capture this data. And so we've had a lot of conversations and have narrowed it down to we're targeting the week of July 26th. And we are, currently recruiting volunteers. We will do a training with them. All of this is coming up in the next couple months, but we have a minimum of 10 drivers. We're looking at, I think our goal is 20, and we'll be covering 100 square miles. And we're using a lot of different data sources and mapping to identify the best places to do that. We really want to capture places that we think are, in talking with, kind of connecting it back to the zip codes. We know that the health impacts of extreme heat are magnified in those areas in the zip code. And we want to make sure that we're collecting the data to be able to use that, again, with all of the work that we're doing around health equity and reducing disparities. We also really want to try and get the word out. This is a great opportunity for us as a city. And so, Carolyn, we look to you and your colleagues to help us share that message and to inform the public about what we're doing. So we do have our communication plan, as you can see, and we are all happy to share information about this project. And then these are existing extreme heat programs. Again, just collecting that data will support existing programs, and I think will position us for additional grant opportunities as we look at the effects of climate change on health. And these are just the different routes that we're looking at, as I had mentioned.
Okay. Well, thank you for that.
And support you,
Carolyn. Sorry, Carolyn.
You're muted.
You're muted, Carolyn.
There you go. All right. Well, very happy to be a part of it. I've already got the information. Of course, I have your contact information, and we will definitely relay that information to the public and try to garner up some support and people who can participate in it. So thank you for sharing that.
Thank you, Carolyn.
Any other questions on the Heat Watch update? All right, we'll just kind of move on very quickly to community updates. I know we're almost at 10 o'clock here, but and I'll kind of go around. Why don't I start with Dr. Richardson if she has any updates that she wanted to add.
Well, I do thank the mayor for yes, that COVID is not on the top of the list of the agenda, but COVID is not totally gone. And I did want to just take a moment to emphasize that while Charleston County is leading the state for the number of the rate of completed vaccinations, we're now at 49% of those eligible. So 12 and over, 49% have completed their vaccinations. We still want that number to be higher. And I think one of the key messages that DHEC is certainly working to promote to the public is for those who are do not have immunity, for those who've not been vaccinated or had a recent infection. We don't want people to be tricked by looking at the overall decline and assuming that the risk is decreased. In fact, we believe the risk is the same for those who are not immune, especially given that many of our community have moved on from wearing masks, practicing other preventive measures. And the way that we're going to leave this epidemic behind us and be able to continue to enjoy sort of this new normal is by encouraging more people in our communities, more of our friends and family to receive the vaccination. So I think I'll leave it at that, but I would be remiss if I didn't bring COVID up in some way on this call.
All right, thank you very much. And we have, I think it's 13 days left at Charleston County School District. I don't know if Holly or Maggie have anything they would like to report out.
I'll talk real quick. I don't know if Maggie does or not, but as far as health and wellness goes, on Monday, our top winning school for the whole wellness initiative will be announced. It's going to be a surprise visit to their school, so I cannot tell you who that is live on YouTube. But keep a lookout on CCSD Media. But that being said, of all years past in the Wellness Initiative program, we had more schools win money this year than we ever have, which is great because with COVID and, you know, it's really easy to throw your hands up and say, we're not doing this, but everybody, you know, did a great job. So that's something to look forward to coming next week within the community. And then we have some other projects underway as far as curriculum and community partners that we're trying to develop to get next year a life skills program and some drug prevention programs that are SEL focused. So the students really won't even know that they're learning how to prevent drug abuse because it won't be talked about, but that's what the program is about. So it's really cool. So we got some cool things coming away for our students in Charleston County in our public schools. Very
good. Thank you for sharing that. We appreciate it. Thank you. Kimbo, you have anything? Oh, Maggie, I'm sorry. I see you down there.
That's
Sorry.
okay. I was just going to chime in and just mention that we are running regional vaccine clinics for students 12 to 15 after school hours, as well as we've hosted a few weekend clinics as well. So those efforts will continue, and that schedule is available on our website. And then just additionally, as we go into these last couple of weeks, we've got graduations coming up, and those are all still being held outdoors in our facilities. Burke High School is using Johnson Haygood. Otherwise, all of our other high schools will be using our facilities with social distancing measures in place, but also trying to, with our mitigation strategies, allow a decent number of guests in the safest way possible. So we're excited for that and continuing our efforts ongoing with vaccinations. So if anybody has any questions about that, please feel free to reach out. Happy to help share information and get the word out.
All right. Thank you very much. Dr. Andrews, anything?
Yeah, just real quick, I'll say that Friday is Wear Orange Day or Gun Violence Awareness Day. This is a national event, so we'll be participating at MUSC. So I encourage folks to go to wearorange.org to learn more and to wear orange that day. As we know, we're in the midst of a gun violence epidemic in the middle of our COVID pandemic, and the rates have gotten worse in our city and across the country. So it's still an important time to shine light on that issue.
Yeah, thank you.
Mm-hmm.
Kimbo, anything you want to share from the Citadel?
No major updates. Much of the talk for us is similar to a lot of the other colleges and universities in the state about just what's going to happen come fall in terms of vaccinations, unvaccinations among students, faculty, and staff. And I think a lot of that's going to be dependent on if any of the vaccines ever get to full authorization by the CDC and such. So a lot of that is the central talk right now. So we're just going to still give that more time over the summer and see what comes about in the fall. Only other major update from the Citadel, maybe I think in mid or late April, if anyone was aware, Citadel was working on a new policy change to update our tobacco policy to allowing cadets to use smokeless tobacco on campus starting in the fall. So There's been a lot of back and forth with that between faculty and staff versus the student body and other constituents. So I think at the moment they're still working on that, but no final decision has been made to figure out what we'll implement in the fall.
Okay, thank you very much. Jennifer Roberts, anything?
I do have a couple quick ones. I'll be very fast. Thank you. I just want to remind this group that our center provides free mental health first aid trainings to the community. So we do an adolescent class where it's not for adolescents, it's about adolescents. And we do an adult mental health class. It's 8 hours and we provide the books and everything. And it helps people in the community understand how to recognize signs and symptoms of mental illness and what to do if someone says they're suicidal and things like that. So if you know anyone interested, let me know. We also have a 2-week art exhibit going on as part of Piccolo Spoleto. It's called Art of Discovery, and it's at Circular Church. And speaking of kids, school district, it is this year we did all youth art from school district, from Charleston County schools, Dorchester County, and throughout the whole Low Country. And it's an amazing exhibit. It's at Circular Church every day until June 13th, and it's open from 11 to 7, and it's a free exhibit. And I'll tell you, if you didn't know it was children when you walked in and somebody didn't tell you, you wouldn't know, because this art is amazing. So please stop by and see us there. And then lastly, I just want to remind the group, and I can send flyers and information on this too, but our Low Country Mental Health Conference is back this year, July 28th and 29th, and it will be at the Gilliard. We just got news that it is opened up to a regular amount of people. We had a limited in-person amount, but we're also doing it virtual, so you can go either way. And it's we got really great speakers every year, and it's 14.5 CEUs. And I'll send Paul flyers for both of those events, just so you know. But thank you.
All right, thank you. Quentin, do you have anything from MUSC you wanted to share?
No, I think, COVID's been brought up, so that's the world that we're still living in right now. We're still working with CCSD to help them with their efforts. We've got some things set up outside of Spoleto, trying to go to where the people are. The River Dogs, we're doing some things outside of the River Dog Stadium on a few nights, and we still have our DMV site downtown. No appointments necessary. So, again, we have a long ways to go, as Dr. Richardson said. So we continue to fight that fight as best we can.
Great. Thank you for all your work. Meredith, anything from you? From Roper? Okay. Joey Current, do you have anything you wanted to share?
I'm good. Thank you, though.
Okay. Well, thank you. Anyone else I missed that wanted to speak anything from our community?
I'll mention one thing, Councilmember Shealy, if you don't mind.
Thank you, Lori.
So we have been taking registration for what will be the first year or the first session of swim lessons. Excuse me, sorry. Because of COVID. So we are finally offering swim lessons this summer. We still have some spots remaining at Herbert Hazel and at the James Island Rec Center pool. Herbert Hazel and MLK pool. So please share that with the community that we're teaching swim lessons this summer. We'll also be doing our summer lunch program that picks up where the kids are out of school. That will begin on June 21st. So a lot of things going on in our community through Parks and Rec.
All right. Thank you very much. Paul? Paul, you're on mute.
Carolyn Murray rubbed off on me. Katie Rich, I want to ask Katie just a quick question. I read and heard you in the last meeting mentioned that maybe in September we would see a shot for the 2 to 12-year-olds, the vaccine. Is that still on target?
Well, I mean, that's our best guess, but the phase 3 trials in that age group are still ongoing. So when those trials are completed, then Pfizer and Moderna, potentially Janssen, will apply for that EUA authorization. And Pfizer, and I think Moderna has just this week applied for the full FDA approval. We don't have a timeline for that, but we certainly hope it will be in the next couple of months, that they do get that full FDA approval, because as Kimbo said, that I think that is going to help us to continue to move the vaccination efforts forward when that approval comes through.
Okay, very good. Susan?
Yeah, I just wanted to, I see that Nick Osborne had to jump off, but I wanted to just give a shout out to the Low Country Food Bank, and kind of to tag on to what Lori said about the summer feeding program. We have a program called Kids Eat Free at MUSC that we've been operating since 2015, and we've been able to serve over 15,000 meals to children in the summertime who are on our campus for whatever reason. Unfortunately, last year, because of the visitor restrictions, we had to pivot, and we were able to receive some shelf-stable meals from the food bank. And because we still have restrictions, we reached out to the Low Country Food Bank, and they have agreed to serve as our sponsor and vendor. So we'll be serving meals at our Summit Medical Pavilion, which is our pediatric outpatient facility, as well as Sean Jenkins through the food bank. So, and they, again, I think they are serving 11 counties through that USDA summer feeding program. So really appreciate their support in addressing food insecurity.
All right, thank you very much. Anyone else? Well, if there's nothing else for this committee, I do want to say thank you very much. A lot of information, great meeting, and I appreciate, I know we went over a little bit, and I appreciate everybody hanging in there with us and giving us your time and all of your expertise. It was a great meeting, and I hope you'll enjoy the rest of your day and the rest of your week. So I'll call this meeting adjourned. Thank you.
Thank you.
Thanks, everyone.